Hello, everyone, and welcome back to the third part of my workshop series on cancer pain assessment and management. In the first two parts of this workshop series, we've talked a lot about an overview on cancer and cancer related chronic pain, as well as pain assessment. For this part and the final part of this workshop series, we're really going to dive into specific intervention strategies or tools that you might use as a therapist. For today, we're going to talk about lifestyle changes, behavior modification, and promoting self management for this population. As always, just my typical disclaimer, please use your best judgment when applying any of these strategies with your own patients. These strategies have all been validated for the use with cancer survivors experiencing chronic pain, but they've also been validated with other populations as well. So you may find that this is something that you are interested in applying with other patients on your caseload. Our objectives for today are going to be focusing on describing the value of lifestyle changes and self management interventions, as well as some psychological interventions in specifically acute and inpatient hospital settings. A lot of research that exists on this topic is really focused on outpatient and home health, but I want to talk about how we might apply some of these strategies in inpatient rehab. We'll also talk about the role of non-pharmacologic interventions in pain management plans, where they might fit and where they're the most useful. And my hope is that as your takeaway for today's presentation, that you can think on your current or previous caseload and think about how you might apply at least one of these interventions with one of your acute rehab clients. The first topic that I want to talk about, and one that I'm going to spend a good chunk of this presentation talking about, is motivational interviewing. This may be a refresher for some of you who have been to lectures about motivational interviewing before. For others, this may be brand new. But motivational interviewing is a communication style you might use as a therapist, but it's more collaborative. The goal of motivational interviewing is to elicit personal motivations from a client and helping to kind of use those motivations to improve commitment to making behavior change. A little disclaimer with motivational interviewing, though, this isn't a way to trick your patients into making a change. Really, the goal here is to uncover motivation that already exists and kind of capitalize on that and help them to see that motivation in order to make lifestyle or behavior changes. This also likely isn't something that you're already doing in your practice unless you've been trained on motivational interviewing. So even though there are things that may sound a little familiar to you, this is going to be communication that's applied in a very deliberate way that does take a little bit of practice. So this is definitely not going to be a one-off. I'm going to talk about motivational interviewing for 10 minutes and you're going to be absolutely perfect at it. It takes some practice and some additional training if it's something you're interested in. But there are things that we can apply now that you could apply as soon as today if you're interested. Motivational interviewing is good for a variety of clients. For our ambivalent clients who really are just kind of happy where they're at, don't really feel like they need to make a change, those clients who may really understand that they need to make a lifestyle or behavior change but don't feel confident in actually doing that, especially when they discharge home, those who may know that they should make a change but don't really have the desire to, the clients whose list of cons for making a change is longer than their list of pros. And finally, for those clients who don't really have a whole lot of clarity on either the benefits of making a lifestyle change or the disadvantages of not making changes. For motivational interviewing, I first want to talk about the why it is helpful as a therapist. In healthcare professions and helping professions in general, it's pretty common for those of us who enter these professions to have this natural want or reflex to fix people's problems, especially in a setting like this where we're seeing people who either have a new diagnosis or a chronic diagnosis that we can really see where lifestyle changes could really make a huge difference in their life. We have a natural reflex to want to tell them. But if we think back in our own lives, if you've ever been told, hey, you need to do this, or hey, you should do this, it's kind of a natural reaction to get a little bit defensive and to say, well, don't tell me what to do. Well, I was actually going to do that, but now I'm not going to do that. A lot of times we have the best intentions, but even for a motivated client or a client with some motivation hiding somewhere, that action of saying, hey, you should do this, or hey, you really need to make this change, we can unintentionally push them in the wrong direction. So, for the sake of motivational interviewing, the creators of this strategy use the term guide, and they shared that a good guide follows a couple of characteristics. They're first going to ask where a person wants to go and establish a relationship with them, establishing that rapport early on, informing the person about their options related to making behavior changes, different strategies they might try, different ways they could go about it. And then as you start to uncover these motivations, listening and respecting what a person wants to do, what changes they want to make, and offering help instead of offering solutions that aren't going to fit with their lives. But how are we going to use motivational interviewing, especially in an inpatient setting? I first want to introduce a couple reminders and then introduce the core skills of motivational interviewing. So here is your rule for motivational interviewing. First, like I said, we need to resist that writing reflex or that reflex to fix people's problems. We also want to understand and explore the patient's motivations. We want to listen with empathy and have patience. And then finally, we want to use everything that they're telling us to help empower their confidence in making changes, encourage them to be hopeful about making changes, and help them to be optimistic in their outcomes wherever possible. Some of these skills of motivational interviewing are going to be asking open ended questions and kind of building on that discussion. Affirming, so if someone says something that either you see as a strength or could be used as a strength, pointing those things out and helping to show patients what strengths they already have, and then reflecting and summarizing. When someone says something to you, kind of reflecting it back to them and saying, so what I'm hearing is you said this, or it sounds like you feel this way about this, and kind of summarizing what they're saying to you. A lot of times we don't or really process the words that are coming out of our mouths sometimes. So having that reflected back to you and said out loud can help your patient to actually process what they're saying and maybe how they're feeling that they haven't quite processed yet. Moving into asking questions and asking open-ended questions, I want to caution you in being careful with the questions that you're asking, particularly with why questions. This is kind of the natural, when you say ask open-ended questions, the natural beginning. Well, why do you want to do this? Why do you want to do that? Da, 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 right? But sometimes the multiple why questions in a row can sound a little bit interrogative and can actually also make people defensive. That's not to say avoid why questions, but be careful in the way that you are asking questions and how many times you're starting with why. So instead of always asking why, you can start questions with, well, what would happen if you did this? How do you think you can actually make this happen? If you're going to ask a why, you can say, well, why are you feeling that way? What evidence are you seeing that this is true? Things like that. You can also kind of move into hypotheticals depending on where you're at in the conversation. If they say, well, I know that I should do this, you can kind of come back and say, well, what would it take for you to actually do this? What might be some benefits to making this change? What might be the best thing that could happen if we improved your physical activity? And what's the worst thing that could happen if you stayed where you're at right now? As we're having these conversations, I want you to pay attention to what is called change talk. The acronym for change talk is called DARN CATS, where we're looking at the desire, the ability, the reasons someone might need to make a change, a need to make a change, some commitment, some motivation that they're already having, and then some steps that they may have already taken. As you're listening for or change talk in your conversation, we want to really emphasize if you hear someone who says, well, I would like to start being more active, we can kind of shift into, well, what would it take for you to do that? What does that look like in your life? What supports or barriers might you have? As we start to hear change talk, we can start to capitalize on it. And as we've kind of started to have these conversations and started to move more into discussing potential for change, we can start to kind of insert readiness to make a commitment. As we hear some of this change talk, we can start to shift to elicit commitment language. What do you think you are going to do? What does the first step look like? What is something that we can do today to help you meet this goal? This is going to be using something called the trans-theoretical model of change. This is something that I would be surprised if a lot of you aren't familiar with, but this is kind of the stages of readiness for change, moving from pre-contemplation, where we really haven't thought much about making changes, people who are thinking a lot about needing to, all the way into actually making changes. As we've started to make some of these commitment statements, we can start to kind of test where a patient is in their readiness for change. Kind of at the bottom of the screen here, I have this scale of 0 to 10. This is called a readiness ruler, where you can ask them about the importance to make a change and their readiness to actually make a change. So you'll want to have them rate on a scale of 0 to 10, either how important it is to them or how ready they feel to actually make a specific behavior change. And then you can keep asking questions. If you were interviewing me and I said, I think when it comes to improving my physical activity, I think I'm maybe at a 7, then you can kind of say, that's great. Why are you not at an 8? And that kind of makes them think about reasons why maybe they're not 100% ready. Or it can even sometimes shift into, I don't know, maybe I am at an 8. Then you can kind of shift down and say, well, you said you're at a 7. Why are you not at a 6? This can kind of help to build confidence and maybe elicit comments like, well, this is something that I think that I could do. I just think that it might be hard to fit in with my schedule. And then you can kind of start to see some of their worries and their concerns and build from there. As we've gotten some of this commitment and an understanding of how ready someone is, we can start talking more about the pros and cons of making changes and help them problem solve early. If someone isn't sure about fitting physical activity into their schedule, you can talk about where physical activity might best fit, things like that. The other way that you can present the readiness and importance ruler is on a grid like this, where importance is on the horizontal and confidence is on the vertical. This is really helpful for, as a therapist, to really understand where in that trans-theoretical model someone might be, whether they're in the pre-contemplation phase in the blue, in the contemplation phase in the purple, or all the way up to being ready to take action. Moving away now from motivational interviewing, the other kind of behavior change / psychological intervention that I want to focus on today is called acceptance and commitment therapy. This is going to be called ACT, not ACT. So as I call it ACT from now on, this is what I'm referring to. But this is a psychological approach that is modeled off of cognitive behavioral therapy, where that is going to use acceptance, awareness, and mindfulness strategies in conjunction with commitment to behavior changes. The goal of ACT is going to be addressing functional deficits by helping people to change the way that they're thinking and the way that they're acting. On the right side of the screen here, this is called the Hexaflex for acceptance and commitment therapy. It is 6 topics where ACT is going to really focus on, and just kind of a brief description. Really, the goal here is to help people to be more aware of their thoughts and to kind of change the way that they are thinking about their concerns, about their pain, and helping them to act more in accordance with their values. And values is kind of the big piece here. If this is something that you really think would benefit your patient, you can use something like a values checklist where you help them to really identify what their big values are. And you can kind of use those values to build skills towards actually making some behavior changes. The goal of ACT is going to be collaborative as well, where the patient is going to be the one who is identifying problems, defining their goals, learning skills that you as a therapist are going to teach, and then actually implementing solutions in their own lives. As a therapist, we are going to listen to their problems and their goals, help them refine those goals and clarify some of their values, teach them self-management skills and encourage their use throughout their rehab stay, and then help kind of transition into long-term solutions, preparing them for discharge and applying these strategies later on. The other big part of ACT is called the choice point. And this is something that I have found to be really helpful for people who get kind of stuck in their negative feelings, or as ACT uses the term hooked versus unhooked. When a patient is in a situation or having a thought or feeling, for the sake of pain management, if you go in the room and they're in bed and they say, I don't want to get up today, I'm in too much pain, I'm not getting up, we can help them to see that they are at what's called a choice point, where they can make a decision to either stay in that negative thought, that negative feeling, and not get out of bed, or unhook themselves from that thought and move towards their goals. This is where establishing goals and values is really important, because when you find yourself at this choice point with your patient, we can help to kind of facilitate, okay, well, I hear that you're in pain today, that you don't want to get out of bed. How do you think staying in bed is going to help you towards your goals or moving away from your goals? If your goal is to be independent, how is not getting up going to help you to become independent? Help let them kind of process through that. They're going to come to the conclusion that it's not going to help them. And we can kind of use this choice point to help them to make some kind of action towards their goals. With pain, obviously, we want to honor their pain. And if they are saying, you know what, I'm in too much pain, I can't get out of bed today, we can kind of say, well, what is something that we can do that can still help you move towards your goals today? Even if that's doing exercises at the edge of the bed or just doing a treatment inside the room. Moving into the final part of today's presentation, just some typical self-management strategies that are going to be related to the management of chronic pain for cancer patients. We're going to really want to focus on activity pacing and energy conservation, looking at body mechanics, joint protection, and ergonomics, making sure that the way that someone is moving isn't causing them more pain or putting them at risk for pain or injury later. Really evaluating diet and physical activity, different routines around activity during the day, medication and stress management, sleep, especially sleep hygiene. I know that that is something that can be really challenging in this setting where they're being woken up all the time. It's not their natural environment, but helping them to kind of promote the best sleep that they can get. Cognitive restructuring kind of fits with ACT, where we are helping to change the way that someone is thinking about something and kind of challenging what are called cognitive distortions, or thoughts of that aren't necessarily based in truth. That's not to say that they are completely not based in reality, but we all have these thoughts. A common one is kind of the all or nothing mentality, where someone has to be perfect at all of these changes or they just shouldn't do it. Helping to kind of challenge those things and change the way that people think about things. And then finally, addressing either social participation or mental health management as well. With all of these strategies, they can be delivered in a bunch of different ways. So some considerations for your application with specific clients, think about which type of intervention when we're applying these strategies is going to be most helpful. Whether that is actually training them on specific strategies, whether it is just coaching them on things that they're already doing and kind of taking that coaching role, and whether they would benefit more from having these strategies taught to them in an individual session or a group session. Different materials are going to be helpful for different people. There are a bunch of different workbooks for chronic pain management that have been found to be helpful. One of them we're going to talk a little bit about next week. It's called Pain Neuroscience Education. Whether handouts or videos are more helpful depending on someone's learning style. And then the other one that I would recommend for anyone with chronic pain is a pain diary, which is going to be in the toolkit that is at the facility at Encompass. I've made just kind of a simple one. The goal with a pain diary is to help people to be aware of when they're feeling pain and what's causing it. So it's just a simple sheet of paper that has them mark the date that they're feeling pain, what time it started, what time it ended, where their pain is location wise, and what it feels like. But then it also has a part of the diary that talks about, well, what was I doing when I started feeling pain? What triggered it, if they know, what they did to help manage their pain, and if that strategy worked. So as they're starting to use this diary more often, they'll be able to start identifying their own pain triggers, things that are causing them pain, but also the strategies that work for them. And then intensity and duration, this is also going to be in consideration of their other rehab goals and what your goals are for them as a therapist towards functional independence. But with these strategies, they don't need to be multiple days or multiple weeks. Some of these strategies and interventions for pain management and self-management can be as little as 20 minutes. These can be conversations that you're having when someone's doing therapeutic exercise, or for patients who are doing in-room treatments, they can be conversations that you're having while you're doing other things. And then you'll also want to consider whether or not you want to include the caregivers in the conversations as well. The last thing that I want to leave with you all today are some resources. The top three are a couple of apps that I recommend. The first one is an example of a pain diary that is in an app. There are a bunch of them. If you just Google pain diaries and help the patient to kind of find the one that's best for them. Some of them are free, some of them are paid, but a lot of them right now are free. This other one that's on the phone display is called Living With. This one is specifically for those who are undergoing cancer treatment. It is a free app for anyone, but it helps to help those undergoing cancer treatment to keep track of appointments, to keep track of their symptoms, and basically just to keep track of their whole life, so that when they're going to their oncologist, their specialist, seeing you as a therapist, if they're using it in inpatient rehab, or taking things to outpatient or home health, if that's something they're receiving afterward, to be able to use. The third one is one that I would recommend for anyone with chronic pain. It's an app called Curable. It is created by pain specialists from a variety of different disciplines. And the goal of Curable is to provide pain education and specific pain management techniques for the person who is using it. I have a QR code in the toolkit, but I can also help anyone who's interested sign up for this as a practitioner. With Curable, as a practitioner, you can set your patients up for 6 weeks of the app for free. The education is free all the time. They don't have to pay or put in any card information. But if they're interested in the premium version, it does have more specific exercises that over time change to be more applicable to the individual who's actually using it. If anyone is interested in seeing it, let me know. I have it on my phone so I can kind of walk you through what it looks like. But it is something that I would highly recommend, especially since pain education is something that is more beneficial long term, but that likely is not going to be realistic in an inpatient setting. This is something we can use to set them up for success as they're preparing to discharge. The last thing that I just want to point out, the pain management guidelines for cancer pain specifically is going to be in the toolkit if you would like to reference it. I will have summaries of that in the toolkit as well. And all of these strategies that I've talked about already, either in this presentation or in previous presentations, are also going to be in the toolkit. Resources for how to use them, patient handouts, worksheets, things like that are going to all be in the toolkit. There's going to be a digital version and a hard copy, and that will be available to you all in my final presentation after May 6th. That is all that I have for today's presentation. Again, here are my references. Thank you so much for taking the time to be part of this presentation. And if you are if you're watching this virtually, please go back to the QR code. I'll also have the link in the description, and just again fill out that brief survey if you would like to be involved in the Amazon gift card giveaway. Thank you so much and have a good one.